Okay, I think we'll get going. Good morning, everyone, and welcome to today's Navigating COVID-19 webinar. Thank you all for taking the time to join us. I'm Kent Roberts, Vice President of Policy at the Halifax Chamber of Commerce, and I'm your host for today. I'm certainly happy to welcome you all to today's webinar, and I'd like to welcome our guests from Narrative Research. Our speakers today are business partners at the national market research company, as I mentioned, Narrative Research, and I'd like to formally introduce Margaret Brigley, CEO, and Margaret Chapman, the COO of Narrative Research. Their passion is digging into data to uncover insights. They are joining us today to explore the pandemic's impact on Nova Scotians and present insights on some of the evident behavioral changes made since March. And I, for one, am really interested to see what they have to share with us. The information explored in today's webinar is based on regional and national research that they have conducted during the pandemic. After the presentation, we'll have time for Q&A. So please add any questions you may have to the Q&A box. At the same time, as we see questions come into the Q&A, we'll break in and ask them. We want this to be somewhat interactive. And also, if you want to ask your question verbally, please feel free to raise your hand and we'll unmute your mic and allow you to come in and ask your questions. So without further ado, I'll pass it over to our guests, Margaret and Margaret. Thank you.
Thank you, Kent, and thank you all for joining us. It's really our pleasure to be with you here today.
Yes, we're pleased to be here today and to share some of the insights we've uncovered over the last few months.
As Kent was saying, at Narrative Research, we really work hard to feed our own curiosities by digging into interesting topics, as well as trying to uncover a lot of great insights for our clients.
And it probably goes without saying, but now is a time of change unlike any other. And because of that change, it's more important than ever to find out what people are thinking, what they're doing, and how they're responding to these societal and global changes. And that's why we've done a lot of research on these kinds of topics over the last few months. We've been sharing much of that information publicly. You may have seen some. Policymakers and companies can use this kind of information to make better decisions that are data-based and decisions that respond to the actual environment.
So we are going to be presenting and referring to data that we collected throughout the pandemic, but much of what we'll be chatting about today is recent from a large cross-Atlantic study that we conducted from August 5th to 9th with 3,300 Atlantic Canadians. And that's from our own East Coast Voice panel, and you're welcome to join up for that panel to have your own say as well, and it's available through our website. There'll also be some data collected nationally at various studies that we did with over 1,300 Canadians throughout the pandemic. So today we want to share with you some of our findings on three broad topics, and we group them into the words that you can see on your screen there. So the first one is work, and that's looking at things around how have working Canadians been affected by the pandemic and what do they think of their employers' response to the pandemic. And then under the category of home, we're looking at how Atlantic Canadians are changing their lifestyles, their travel habits, purchases, and other behaviors, and what that will mean for the future. And then under the category of fun, well, we know that the pandemic is a very serious matter, but we're pleased to uncover some silver linings as well. So we're going to start off with how the pandemic has affected working Atlantic Canadians. And we asked on a cross-country study about the economic or financial hardship that people experience. So Margaret, what percent said that they were suffering?
Well, on a 1 to 10 scale, where 1 is no hardship at all and 10 is a major financial hardship, we saw that 3 in 10 Canadians said that their household had experienced a major economic hardship. That's 29%. And Atlantic Canadians were a little better off, in fact, with a quarter saying that they had a major financial hit.
So for context, how many people's working lives have changed since March?
Well, what's interesting is that more than a quarter of the working population was negatively impacted by the pandemic from a job perspective. Likely those same people who told us their household was hit financially by the crisis, including some changes to working hours or to pay.
Okay, and so for some, those changes have certainly hit the pocketbooks. In terms of what people are taking home, but we also looked at how people are working, not just how they're hit financially, but also how they're working. And that's changed as well, correct?
Absolutely. More than 6 in 10 Atlantic Canadians have transitioned to working from home. Think about what effect that has on home life, on the amount of gas people buy, on whether people are buying lunches from downtown canteens or even picking up a coffee on their way into work. While there are certainly upsides to not having to commute, there are also real downsides for local businesses and downsides as well in terms of the work environment.
Yeah, and a question you can see on your screens already, the results there. A lot of people wonder about, so 6 in 10 are working from home, but are they productive?
Mm-hmm. So it turns out that about a quarter of employees feel they're more productive, and about the same, 29% say they're less productive. So half say they work just as well as at home as they did in the office. And you can look at that finding from a couple of different angles. From an employee perspective, it's great that 3/4 feel as or more productive at home, but we can't ignore those who are less productive. And we need to find different ways for those employees to thrive. From an employer's perspective, it's never been more important to have metrics in place to measure productivity, to confirm that work is getting done efficiently, and that work isn't bleeding into every part of an employee's life while working from home. That work-life balance is so important.
Yeah, when you're at your kitchen table, right? Now, I know that we looked into how people felt about working from home. So we talked there about the productivity, but we also were asking them about what they preferred and whether they liked it. And it seemed to be a bit of a mixed bag. Some love it, want to continue. Others want to get back into the office. Why do you think that opinions were so divided about where people want to work?
Well, that's right. Exactly half of those who have moved to working from home said they'd prefer to work remotely. If given a choice, a third said they wanted to be back in the office, and 2 in 10 are not sure. So it's likely those who are working from home that are finding, they have fewer distractions, less time commuting, reduced expenses. But again, we can't ignore the negatives as well, which could be contributing to the opinions of those wanting to be back in the workplace. Things like increased isolation, less collaboration, wariness of screen time, and remote meetings, and the whole work-home separation. I think we've all seen people's homes on Zoom calls, and many of them are cobbling together an office at their kitchen table, or they're having to juggle competing interests, whether it be from childcare to their partners or limited bandwidth too.
For sure, and also struggling with that mute button. We've also looked into how employees felt about how their own employers were dealing with the pandemic. And to be fair, many were working on the fly, making decisions on the fly. We certainly were. You don't always have complete information to make those decisions. And with that kind of pressure, how did employers do in the eyes of their employees?
Well, it's interesting. Across the region, employees are saying their employers did well. Over 8 in 10 are satisfied with their employer's response. Even though, as I mentioned earlier, collaboration can be difficult remotely, during this crisis, employees believed they worked well as a team. And we measured some other things too that you can see on the screen, and whether or not they believe their employees' health and safety had been made a priority during the pandemic. Most do believe that to be the case, or that employees are being treated fairly during the pandemic. And 8 in 10, they believe their employment is secure. So some interesting thoughts in terms of the employee-employer relationship.
It looks like employees were generally really satisfied with their employer's response. Like that's well, at least a B+, right?
And it's certainly been such a challenging and new environment for employers. We have not had to deal with these situations in the past to the same extent. So let's turn to things outside of work and how the pandemic has affected people's lives. We talked earlier about the 3 in 10 Canadians who have experienced a financial hardship. We also found that 1/3 of people experienced an emotional or a mental hardship during the pandemic. And that's a huge portion of the population. And coping with all the changes is something we can't ignore. We're all living in very different times now that we are 6 months in, and we're not traveling internationally. We're wearing masks everywhere we go. It's clearly a different world. So let's look at how things have changed on that side.
Right. So we'll start off with a question that we asked this summer around how people were feeling and whether or not the pandemic brought the country together or not. And we found that across the country, over half the population said that the pandemic experience served to draw Canada together as a country. And for us in Atlantic Canada, that was true as well. 60% of Nova Scotians said yes, 65% of those in Newfoundland and Labrador, and 57% of those in New Brunswick. So in divisive times, it's a really positive thing to see that people felt that we were all going through this together, and it kind of brought us together as a country.
Okay, they're feeling more united, but they're not really traveling to see each other in person, right?
Well, quite a bit of travel actually within the Atlantic bubble, but a lot less within the country as a whole. So when we're talking about Atlantic Canadians now, we found that 1 in 5, so 21% there, traveled within the Atlantic bubble since it opened in July. And people in PEI were the most likely at 38% to travel within the Atlantic bubble, while only 7% of those from Newfoundland and Labrador traveled within the bubble. And Nova Scotians and New Brunswickers were pretty likely to travel in around the quarter of the population traveling within that bubble. So that's a lot of movement within the region, with the exception, obviously, of Newfoundland and Labrador. But when we looked to whether people had traveled outside of the region but within the country, only a handful of people had traveled outside of the bubble, just 3% overall. And that's likely because of that quarantine requirement. A lot of people couldn't or didn't want to travel, and then have to come back and be in isolation for 2 weeks. So a really low percentage there.
Sure. There's been some discussion around whether the bubble was actually well managed. You know, we've heard about lineups at borders and that sort of thing. What did those who travel think?
Well, this is one of the areas where we say the research is so great, because you find out whether what you might be hearing on social media or by word of mouth is representative or just a few people who are grumbling. And in this case, it really seems that it was a few people who were upset, because 9 in 10 of those 21% of the population who traveled within the Atlantic bubble, they told us that they were highly satisfied with the arrangements put in place by the Atlantic region's provincial governments. So they were really generally very happy with how things went. Indeed, only 1 in 10 expressed any level of dissatisfaction. Now, there were huge lineups at the beginning, but it seems like a lot of people were pretty understanding about it, and that things have leveled off.
Being a little patient, perhaps, given this current situation or circumstances. Oh, okay, so speaking of travel, what are people thinking about in terms of opening up borders?
Oh, hot topic around the water cooler for sure. And we asked about both people's opinions of opening up the Atlantic Canada bubble to the rest of the country, as well as opening the Canada-US border within the next month. And to be clear, I think this sometimes gets mixed up when we're talking about it. It's always been possible to travel from Nova Scotia to the rest of the country and vice versa. So what we were asking about was whether that quarantine period should be dissolved. Mm-hmm. And the results were incredibly clear. Overall, more than 3/4 of residents, so 77%, told us that they opposed opening the bubble, and 4 in 10 expressed complete opposition. And 1/3 there, you can see 35% said that they mostly oppose it. And although the vast majority of Atlantic Canadians oppose lifting the quarantine and reopening the border to the rest of Canada, Nova Scotians are even more, just by a bit, but even more likely to be in opposition. And results are pretty consistent across all the other demographics that we collect. So age, gender, income level, and so forth. It's pretty
really interesting.
Opposition, yeah.
Yeah. What about the US border, Margaret, given what's happening there?
Well, I bet those of you listening would guess that it's strong as well, and you'd be right. You're not surprised, I'm sure, to hear that when it comes to opening up that Canadian-US border within the next month, essentially all Atlantic Canadians do not want it to happen. And it's interesting because we asked that same question in July to a panel of Canadians across the country, and opposition has actually grown. So back in July, just 2/3 of Canadians opposed opening the Canada-US border, and you can see now it's 95% are in opposition, with 88% of them being in complete opposition. And when we analyze results on word scales like this, we always look most closely at the superlative responses, because someone who says, I completely support or I completely oppose, is committed to that, that response. They feel really strongly. And the people in the middle are a little bit more movable. So when we see that dark orange bar of 88% saying they completely oppose it, the feelings are strong.
Well, we're approaching September very quickly. A lot of discussion's been happening about schools reopening in a couple of weeks, and many have made a connection between the border staying closed and schools.
Yeah, and I think the borders being closed has provided a degree of comfort for people in sending their kids back. I don't want to make light of the closing of the border, but I do think there is a psychological safety feeling from having the bubble closed for a lot of people, and it's probably why we're seeing that opposition. So we asked parents, and we found that people with school-age children have a clear desire for them to be back in the classroom in September. We also asked people who have folks in their household who are going to be attending post-secondary as well. And although many people prefer some kind of blended approach of in-person and remote learning, the desired approach for school is really highly dependent on grade level. It makes sense, right? With a preference for in-person classes for the lower grades. So you can see for preschool, for example, 70% of parents with preschool children said, I want them to be back in the classes as long as there's safety precautions. But then if you move to high school, 15% said that they wanted only remote learning, parents there, and 44% said they wanted that mix of in-person and remote. And that's likely, having to do with the age of the kids.
Do you think the parents' strong preference for in-person classes for that younger age group is reflective of a desire to have teachers do the teaching, rather than requiring parents to assume homeschool responsibilities, as many of them had to in the spring?
Yeah, so I think it's coupled with both the comfort for many people sending their kids to school, given our low COVID case numbers in the region, and that gives a sense of confidence, along with that age of the kids being able to self-learn or not. And obviously, with preschool or elementary school kids, parents were really taking on the burden of teaching at home, and it takes a lot of time and effort compared to older kids who can probably be a little more self-directed.
Sure. We asked about some other lifestyle changes. And again, back to how things have changed when we look just 6 months ago.
You look at the questions we're asking now, and it almost seems ludicrous that we would be asking people about whether you'd gone to a restaurant or not. It's probably not that interesting a finding, but in these current times, it's something that's really interesting. So we've been tracking that, and 4 months ago, only 2 in 10 across the country said they had any intention of visiting a restaurant. And more recently, 2/3 of Atlantic Canadians said that they had had a meal in a restaurant. So that's really gone up. And that was within the last month. Clearly, people are getting out more comfortable and feeling more comfortable about being out and about. And what's fascinating as well is the rise in home delivery. So that's a huge change from before the pandemic. 4 in 10 are now saying that they've had food delivered recently, and 30% have ordered groceries online. And for many people, over half of the people who did these things, they said there's obviously comfort in doing those things online, such that they would like to continue doing that when the pandemic is over. So, you can see grocery stores kind of gearing up and providing the infrastructure to make that work. And people are obviously finding it convenient because many of them want to keep doing it.
This is when we'll see just how much of a permanent shift in behavior will there be as a result of the pandemic, for sure. And it's interesting, when we asked in July about Canadian support for mandatory mask orders, there was really strong support. 83% supported it, but 12% opposed it. And now when you go out, you see here in Nova Scotia, very strong compliance with the new mandatory order. And it's likely that we're seeing lower levels of people going to restaurants due to a variety of reasons. And certainly those opposed to, unable, or uncomfortable with wearing masks are likely the ones staying home. And then there's medical appointments. A lot of talk about changes in how we deliver healthcare. And I know personally, I've seen huge efficiencies in the last few months in how appointments are booked for things like blood tests or x-rays, and wait times are much, much shorter. So the efficiencies are just very, very evident in the process that we have for our healthcare delivery.
It's remarkable how quickly things have changed, and it's fascinating to see the results here as well. I think what's happened is that a lot of people have refrained from getting medical care for a few months, or they were unable to get care in those first few months of the pandemic. And now we're seeing a lot of people having appointments, and many of them are doing that online. So when we asked a couple of months ago, a quarter of Canadians told us that they were having telehealth appointments, and about a quarter of those said that they would continue to do that after the pandemic, in that they would like to continue to receive health care remotely. But more recently in Atlantic Canada, so this month, it's pretty striking. A whopping 66% said that they had had an online consultation or a phone consultation with a healthcare professional. So that's a big percentage of the population getting remote healthcare.
Big changes for sure. And it will be really important to understand perceptions of new ways of delivering service. So there are, of course, opportunities to make things better as we learn more to work in this new COVID-19 reality.
Exactly that. And one really interesting area we asked about in the spring was just about those changes and whether what we can do as we transition. So we asked people whether government actions to stimulate the economy should also include actions to help fight climate change. And the vast majority of people told us yes. It's either critically important or important to ensure that we help the environment while we're helping the economy. Mm-hmm. So this points really to an opportunity to make things better as we work within this completely new economy. So we're going to finish up now with some positive outcomes that we mentioned up front. We, of course, want to acknowledge that the COVID-19 pandemic has caused considerable hardship for many on financial and health fronts. We showed that right at the start of the presentation. A lot of people have been affected mentally, emotionally, and financially. But we also wanted to understand what good may have come from the huge changes to employment and lifestyle that we've discussed.
Exactly that. And anecdotally, we saw lots of baking happening, even shortages of yeast. You likely heard about those in the news. Other activities from gardening to enjoying parks and the outdoors. So we asked Atlantic Canadians last month about what they had experienced. And what we found was that most have relaxed more than usual. We've baked or cooked more than usual. We spent more quality time with family, friends. And we've read more than usual. Really good positive outputs. Close to half indicated that they have slept more than usual, while 1/3 have exercised more than they normally would. And given the amount of baking going up, we may need to focus more on exercising, I guess, as that increases. But a quarter of Atlantic Canadians report having developed a new friendship or deepened an existing friendship during the pandemic.
I found it hilarious when we were looking both at these silver lining results for Atlantic Canada and when we looked nationally at those same questions, that Nova Scotians really punched above their weight in terms of both baking and cooking. So over 2/3 said that they had done more baking compared with somewhere between half and 60% in other provinces. So Nova Scotians like to bake.
What's interesting too is that baking and cooking across the country is highest in the 25 to 34-year-old age group. Perhaps some newfound loves of experimenting in the kitchen in that millennial age group now.
And you never know, that may continue after the pandemic too.
Yeah.
So we have lots and lots of data. We collect a lot of data on a weekly basis, and we could talk all day about this stuff, but we really did want to open things up for questions and clarifications or to anything that we've been discussing.
And we also want to see if people have any ideas for things we could be asking about in the future. We're always interested in hearing what people are curious about. So would love to welcome any of your comments or questions.
So thank you both, Margaret and Margaret. That was fascinating as always. And having done some research in my past, like the ability to sort through the data is the magic of what you guys do, because I know how much data you can collect. But then finding the nuggets that are really important is tough work. So we really appreciate that insight you're sharing with us. So I encourage everyone, yeah, please jump in and ask some questions and provide any insights to our friends at Narrative Research that you might. So one question just popped up on the Q&A. So was there any data collected on if people plan to travel, and if so, when?
Yes, we did, and I'm just pulling that up so that I can speak to the actual numbers. But yeah, we did ask people about their plans. That was earlier in the summer when we were asking, like, do you plan to take a summer vacation? And if I recall correctly, there were a whole bunch of people who said that they would not. They really were worried about, so this was kind of, if I remember, and I'm just pulling it up, but I think it was in June that we asked that question about people's plans to take a vacation in the summer, whether it was within their province, within the country, or further afield. And I think what we've seen is in behavior is that a lot of people have actually done a lot of outdoor activity that they weren't doing before. Lots of camping. We hear about a lot of people selling out of camping gear and outdoor gear, and you know, try and get a campsite in many provinces, and they're all sold out. So I think what's happening is that people are doing the activities where they can be outdoors and they can be safe, but still have a sense of a vacation. And I know there's lots of recruitment efforts and pushes, marketing efforts for people to get out and explore their own provinces, Nova Scotia included, which is great. It's great for the tourism industry. It's great for our kind of change. It's great mentally to have a change of scenery for sure. So it's an interesting question that we could explore going forward, because I think people's hesitancy around travel has been largely around the unknown of what airports would be like, and you know, whether they'd be allowed to stay in hotels and what protocols would be like. And my suspicion is that folks are getting much more used to the safety precautions that are in place for any public location. You know, everybody's used to wearing masks now. You go into a hotel or a restaurant and it's kind of becoming normal. So I suspect that the numbers we collected in June are really going to go up.
And again, it goes back to the figures that we mentioned. 1 in 5 have traveled, certainly within the bubble, and that in itself is a pretty important number to consider. You know, traveling around Atlantic Canada, and aside from the 14-day quarantine requirements and coming back, I mean, it's really time prohibitive if you do need to spend time, obviously, at home in a quarantine. That's a challenge if you do want to travel anywhere. So.
Yeah, and just to build on that too, we did some anecdotal research, or not anecdotal, so we did some research here at the chamber as well early in the summer, and a high percentage of our members as well said they were going to travel within Atlantic Canada or within the province. However, it was interesting, most of them were going to stay at their cottages. So it'd be interesting to see if that has changed, because I know anecdotally when I go on and try and book an Airbnb, they're booked solid. So I think people are about exploring staycationing across the province, and I think maybe that barrier a little bit has come down on the fear of staying in a hotel or in an Airbnb for sure.
Yeah. And I think to your point, just fear is an important word that we really need to follow up on here. And Patrick just posed one question. He said, you know, the information on the resistance to open the bubble appears clear. Clearly it is. And he asked if we have any sense of whether they have, respondents would have an awareness of what is actually going on in other provinces. And he gave, he cited an example. You know, August 18th, PEI had 1 case in 50,000 people. Ontario had 1 in 154,000. I'm going to step back on that comment on fear. There is no question that the scope of how we have been impacted is very minor compared to other locations. We are in an enviable position in this province and in this region compared to other parts of the country and other places. But people are fearful. They're fearful. We've had to do so much, so much efforts were taken in the past few months that I think people are just really hesitant to make change for what it could cause.
But I think to Patrick's question there, that it's hard for people to grasp those kinds of numbers. So we know that people have much better affinity for stories and anecdotes than they do for numbers. And I think if you told people 1 in 50,000 people in PEI versus 1 in 154,000 people in Ontario, it's jarring, because you hear that there's these outbreaks and you hear that there's, stuff going on in Ontario. And so I think that huge opposition we saw in our research shows that people are scared of what's happening in other provinces and may not be aware of the kinds of numbers that you talk about, where there's actually even though our raw numbers are low, our incidence per capita is actually in some cases higher than in other hotspots in the country. Right? So that says to me there's a lot of information that needs to be shared to give people the context to understand what relative safety is. And we've got to live with this virus. It's not going to go away. So I think it's really important for people to start to understand some of those types of numbers. And to me, what I've experienced is that you have to tell stories around those. You can't just spout the numbers. You have to show those numbers in other ways.
Yeah, it seems like the initial reaction is always emotional, and fear is one of those emotions. And then you, as Margaret, as you say, you kind of need to move into the facts and try to dispel some of those fears and notions. I mean, the simple one that I know that keeps coming up is air travel. Everyone's scared to death. I'm not getting on a plane, but there's not been a single case of COVID communicated on an airplane to date. But that's hard to break through that emotional barrier.
Yeah, and I just had a look, and our numbers on that intention to travel and intention to fly are really low. So only 13% of Canadians said that they had any intention of taking a flight. And I think the numbers actually bear that out, or are even lower. So people are really resistant to that type of travel and to it's an unknown as well, right? I think as we learn more about the virus and how we can keep ourselves safe, as you say, we can keep ourselves safe, it seems, on flights, but it's still a bit of an unknown and a perceived risk, which is why I think our numbers bear that out, and intentions being pretty low.
Yeah, and I think what it means too is that for many to overcome that fear, there will need to be much education in terms of really letting people understand just how great the risk is and how they can mitigate that risk, so they can get to a place where they are comfortable. And
we asked people that question, like, what would it take for anybody who said, I'm not going to take a flight, I'm not going to go and get a haircut, I'm not going to go to the spa, go to a restaurant, whatever. We said, well, what would it take for you to undertake any of those things? And the top reason was having a sustained period of no new cases in my province. Mm-hmm. And how long is a sustained period, and is having one case here and there going to break that and stop you from going? Vaccine actually was lower down the list.
That's a dangerous sentiment in my mind, of no cases. I mean, there are going to be cases. It's how it's dealt with and how it's managed. That's what people need to get their head around. There are going to be outbreaks.
And you may have seen in the media, we did some research around people's intentions to have a vaccine to actually get the vaccine once one's available. It's a theoretical question because we don't have an actual vaccine to talk about right now. But in theory, it was lower than you might expect. Margaret, you may recall the exact number, but I think it was around 7 in 10 said that they would get the vaccine.
Yeah, that's right.
And that gives you some pause as well. You think, well, once a vaccine's available and not everyone's going to get it, why is that? And I think that's an interesting area that we might do some more research in going forward. we suspect it may be, people don't know how effective it's going to be, something brand new, how safe is it, what would the interactions be, all that kind of stuff. There's a bit of worry. But with other vaccines like measles or those sorts of things, you need a really high percentage of the population to have the vaccine in order for it to be effective. We don't know with COVID whether that's going to be true as well, but if it is, we're going to run into a problem because not all Canadians are thinking, yeah, I'm going to rush out and get it.
Yeah. Patrick asked a question that I think touched on Margaret Brigley's comment just a second ago about changing that narrative and changing that message to reduce that fear. Patrick says he came across the bridge and the Bridge Commission sign still up that says stay home, stay safe. I mean, that was a message that got us to do that, and it's ingrained now in people. So trying to change that, how, Patrick's question is, what can we do to encourage people to at least travel within Nova Scotia, and sort of who needs to help change that message and how?
Yeah. And unfortunately, it is an emotional action. People need to feel comfortable. They need to feel safe. And there are such huge economic consequences of what's going on. There's no question. And when we think, what can we do to encourage people to travel? I mean, it's public education to let people know that the risk is minimal as long as you put certain safety precautions in place. As long as again, we have so many advisories on from our health sector saying, this is what you need to do, and you'll be safe as long as you do that. And people need to have faith in that. And I know Margaret has as well. We've had the staycations where we've traveled throughout the province in the past few months, and you do so conforming to the advice that we're given, and people need to have confidence in that advice.
I think there's a huge amount of uncertainty with return to school, and I think this period in the next couple of weeks, while people kind of wonder what's going to happen when students come back from other provinces, and when we get students together in schools, what's going to happen. To me, there's a bit of a wait and see period that people are sticking with that stay safe, stay home mentality until we know what's going to happen there. I suspect if things go well, that it'll be easier to convince people that it's okay to get out and about. But the Stay the Blazes home message that we had here in Nova Scotia was so effective, and I think it's really continued to resonate. So there's a lot of uphill battle against public sentiment to say, let's just be conservative and cautious here to stay home.
And I will say too that, again, Stay the Blazes home, we were given direction, and we were really good at following that direction. I think government in particular and key business leaders, they need to set the example and demonstrate when it is safe and when certain actions are completely acceptable and in the realm of what we should be doing. They should be demonstrating that, not contradicting it. And so unfortunately, having the sign, stay home, stay safe, is perhaps a little dated, and is it sending the wrong message? At what point does business and government in particular, especially in Halifax, where we have such a large public sector, we need some examples to be set.
Yeah, I think it'll be interesting as we go through the fall too, just as an aside, how, as we go into flu season and cold season, what is the outcome of that? So we may have a few COVID cases, but if all these kids in school are not coming home spreading the common cold to their families because they're all wearing masks, it'll be an interesting, a sidebar to this whole thing.
And what's the threshold too? What's acceptable and what's not? What can our healthcare system, well accommodate? And is 0 cases really realistic? Is that a threshold that we should even be considering? And I think having those kind of discussions that will help put people at ease.
I think so too, and I would love to see Dr. Strang sort of change that narrative to say it's not going to be 0. What are those kind of thresholds that we're considering in the health department to manage?
And it's okay not to be 0.
Right.
It's that fear.
We found a lot of people really highly satisfied with their government's response to the pandemic as well. So I think with that high level of satisfaction with the response, it indicates a high level of trust in what the government's been saying too. So that gives some power to government to have really authority and direct people. So I think if there was a really strong narrative about, it's okay to go out and safely move about and go to restaurants and, go back to work, with proper precautions in place, obviously. I think that level of satisfaction actually gives some indication that people will trust government to.
That's right.
And what they're saying.
Gives them some license in their statements.
That's the word I was trying to find.
Yeah.
Yep.
I want to come back and ask you just a question about one of the stats that you mentioned, that 29% people are less productive working from home, and 46 are as productive. So if you're an employer, do you think some of these employers are starting to look and go, it's not going to become voluntary to work from home much longer? Are they going to start to force their employees to come back to work?
Well, you have to keep in mind too, from an employer's perspective, there are a couple of other things that are really important considerations, and it's where the investment's been made from a technology perspective, but from a bricks and mortars perspective, and many businesses have invested. They've built offices and or have very ironclad leases, perhaps, where financially it just does not make sense to say, oh, let's just transition everyone to at home. And even those working from home, the settings, it may be great to be able to, be in your pajamas or put dinner in or throw in a wash or whatever. But the fact of the matter is, if you're working at your dining room table, that may not be the best setup from a health perspective as well. Yeah. So there's so many other considerations.
Yeah. And from an employer's perspective, you guys mentioned it'll become more and more important to measure that productivity at home. Mm-hmm. Are you seeing anyone doing that, and how are they doing it? How do you measure productivity when you're not in contact with your employee on a day-to-day basis?
I think looking at outcomes is the biggest measure of productivity, right? Here's the thing the widget that we produce, or the report that we write, how long does it take to do that? And can we do that in the same time or less time or more time than we used to? So I think really looking, there's lots of tools, technology out there to monitor when people are online and how they're spending their time on their computer. And I don't think anybody wants to be micromanaged. Right. But I think looking at outcomes is probably one of the best measures for employees. A self-serving plug as well is that we do a lot of employee opinion research, and I think it's really important not just to look at the hard outcomes of your business, but also to keep tabs on how employees are feeling. Super important. Some people feel as productive or more productive, but that 1/3 who are less productive, what toll is that playing on people? And it's, I believe, really important for employers to touch base with people and say, what can we do? Can we find a way to make you feel more productive and to make you more comfortable in the workplace, and to make sure that, you have that work-life separation? You hear a lot about people burning out because when they're working at home, their computer's just right there. So you're answering emails, I think as Margaret said earlier in the presentation, work starts to bleed into other parts of your life, and we know that that's psychologically not healthy. So I think for employers, the advice is really on those two fronts, to measure productivity, but also to measure employee sentiment, and to get a hold of how employees are feeling now compared to before.
And depending on the sector you work in, this is a very different reality. And when you're in professional services, you have been tracking how people are spending your time. So it's quite natural to see whether or not people are as productive or not, just in terms of looking at where the time is being spent. But outside of that, most businesses do not, as a matter of course, record how employees are actually spending their time in any given day. So you can monitor things like, you know, the number of widgets produced if that's what you produce, but there are so many other factors that you just don't traditionally monitor. And more than anything, if there's a good to come out of this pandemic from a business perspective, it may be forcing businesses to actually look at how they can evaluate the end outputs within their business.
Yeah, I think both of you alluded to something that I is in the back of my head, that businesses are going to need to pivot their HR departments a little bit to be much more in tune and reactive to working from home. I mean, that's a different scenario that most businesses are not, you know, haven't been exposed to. And that HR perspective, the mental health, the tracking, the evaluation, that's all going to be done remotely. And that's a new kind of HR.
That's right.
Okay. I had a note here to myself when you guys said 9 out of 10 said they were highly satisfied with the travel arrangements, and you were debunking the social media. I just want to put it out there that I hope we can turn to you guys now for the future of debunking all our social media fake news that pops up.
Yeah.
Yeah, it's the context of whether, you know, not to minimize real experiences that are negative, but it's so important in those kinds of instances not to generalize and to, you know, I've probably said it in context of maybe many of you online have already heard this, but the plural of anecdote is not data. And I think we have to remember that you can't just generalize a few, you know, I had this terrible experience and think that that's the way it is. It's really important to see, is that a minority that's upset, or is it representative of everybody's experience?
That's right.
You know, I thought, I mean, all joking aside, I thought that was a very relevant piece of data. 9 out of 10 we're pretty happy with the arrangements that have been put in place. You mentioned that, you know, a fairly high percentage are traveling in the bubble in Atlantic Canada, and I mentioned it a little bit. Did they give an indication of where they're staying? And I know I touched on it briefly.
Yeah, we didn't ask that. Certainly a good point. So we don't know whether they're in campgrounds with family and friends, or they're actually in accommodations.
Yeah.
And another quick question is, so 77% agreed that the quarantine should not be dissolved currently. Did you get a sense of why? Is that just that underlying fear factor? You know, the rest of Canada doesn't have the 14-day quarantine, and the cases are really low. And is it just that, hey, we're good in Atlantic Canada and let's not change it?
I think it's the emotional response, and although, you know, to say it's low everywhere else in Canada, I mean, we are seeing hotspots, you know, flare-ups in certain locations, and I think it's emotional. People are afraid. They're afraid of what it could potentially turn into, and I mean, we're all in tune to what's happening in the States and how things have you know, ballooned in certain locations when it does get out of control. So. Again, I think the public needs that reassurance. They need to understand what level of risk is actually associated with that, and what's real. So.
We actually have a survey in field right now, and actually I think it's coming out today, and we'll have the results nationally about just that question around travel restrictions within the country. And my suspicion is that people will like people in Atlantic Canada don't realize that the bubble is unique, and that all the rest of the provinces, Manitoba potentially aside, are open. Like, I don't know that people understand that. And I think it's going to be fascinating to hear what people think nationally about having unrestricted travel within the country. So we'll be releasing that next week.
Yeah, that'll be very interesting. Just switching gears a little bit to the school question. Not really a question, but almost an observation that 70% of people with preschool children, you know, want them back in school, and I get that totally, because you know, the parents at home with the preschoolers. It seems a little bit risky in a sense that may be the highest risk population going back to school as well, like trying to get a preschooler to wear a mask all day and you know, that
to stay away, to be socially distant.
Yeah. Another question I had on sort of the home delivery and 67% had a meal in a restaurant, home and delivery 4 and 10, 30% are ordering online. Are you seeing from a business perspective that companies that pivoted that quickly into that mode are more successful? Do you have any sense at all that the move to digitization was a real change agent for some of these businesses?
I think it's too early to tell that yet. I mean, time will be the real marker for sure. Businesses have responded, and for many, it's been survival instinct. You've had to pivot in order to prevent your business from being shuttered completely in some instances. So it's too early, I think, to tell. Are those going to be most successful, for instance, and how long it's going to be maintained or sustained, that interest.
Yeah, I think you're right. The sustained interest will be interesting. Yeah.
Well, especially because I think a lot of people are going out to restaurants when there's a patio and you can eat outside. And as the weather starts to change, I don't know how many people are going to make the effort to go. If they don't feel comfortable eating indoors, if they're going to make the effort to bundle up and eat outside with a heater or those sorts of things. So I think things may shift a little bit, unless we really do a good job of making people feel safe with the precautions that need to be in place to make it safe.
Yeah. I think that the June retail numbers were a little telling this week too, the explosion in retail shopping as soon as people were allowed to do that. So, I mean, the online is great, but people still want some face-to-face. So that bodes well for our hard surface retail stores. So I think that's good.
Pent-up need too, right? Nobody shopped for a couple of months and then all of a sudden I really need new jeans. All that baking.
Yeah.
It's funny you say that, how empty the store shelves still are. Interesting. I'm gonna close off very quickly. I think we're almost done. I did have a comment which I thought was fascinating, and that was around the 82% thought climate change was still as important as the economy, or equally going through this. And that I found that fascinating. So it just goes to show that even though we're in the middle of a pandemic, the number one issue probably in the country is climate change, and it stayed there, which is
it was a really interesting set of questions that we asked around, like, okay, we're going to have to do things differently. The government's putting in place all this stimulus. And I was really surprised and glad to see that people said, okay, while we're doing this stimulus, let's not just focus it on, whatever's going to build the economy, but let's be smart about it and make sure that it's going to fight climate change while we're boosting the economy. So that's such strong support. I was personally surprised to see it, but also really glad to see that people were thinking that, being that forward looking.
Yeah, and Kent, I think it's important. We're not trying to suggest that they think it's more important than the pandemic, for instance. But I think it really demonstrates that there's a recognition that the two can work in concert. Yeah. That efforts to address the economic situation can also be very much focused on moving towards a more green economy.
Yeah,
certainly not one or the other either, right? Like
it's encouraging. In fact, it's encouraging that people are saying we can still do this while we deal with this pandemic issue. I was shocked how many people said, "I can't believe they're bringing back plastic bags at the grocery store." Like there had to be a better way, even during a pandemic. But that's an interesting perspective.
Yeah.
Okay, did you guys have any final comments?
Thank you for the opportunity.
Yeah, and again, if anybody has any ideas for things that they're burning desires for questions, we're in field every week with new research, and we're just, as I said at the start, we're kind of feeding our own curiosities about some of these hot topic issues, but we're always interested in understanding what people would like to know as well. So.
Well, thank you. Thank you both, and both Margarets for sharing your research and findings with us this morning. And thank everyone online for joining us. We hope you've been enjoying the Navigating COVID-19 webinar series from the Chamber. It's interestingly enough, we are going back to some in-person events very soon. We do have a golf day at Glen Arbor coming up on October 7th. And we're doing a wine on the waves, a wine and cheese on the tall ship Silva as well on September 18th. So anyone has interest online, please go onto our website and sign up. All of our webinars are also recorded and will be available very shortly on YouTube. So with that, I'd like to thank you all for taking time out of your morning to be with us. I'd like to thank the two Margarets again for joining us and sharing that valuable research. And we hope to see and talk to you all very soon. Thanks very much.
Pleasure. Thanks for having us.
I know.